Welcome! This video is a full walkthrough example of an in-home health risk evaluation, or HRE. It demonstrates what an in-home visit would have looked like prior to the COVID-19 pandemic. Please refer to your training in the learning community for additional steps to take during this pandemic. You will notice during this visit that the clinician does not complete the assessment in the order exactly as the questions appear in the application. This evaluation demonstrates one clinician's workflow, but incorporates many best practices to help with efficiently working through the evaluation. We recommend completing the evaluation in the order as presented in the application until you become familiar and comfortable with the HRE. Once you become more familiar with the evaluation, you may find your own workflow and efficiencies that work for you. We still recommend the workflow as shown in the video, as it covers all the questions relevant to this clinical scenario while managing to keep the face-to-face encounter close to 40 minutes.
Hi there.
How are you?
Good, thanks. I'm Maureen Smith, nurse practitioner here for your health plan.
Okay, come right on in.
Thank you.
We're gonna go in the kitchen.
Prior to the assessment, ask the member to gather all medications, glucometers, lab reports, and a list of their clinicians. Many clinicians request this of the member when reaching out to them on their call the day prior to the visit. Alternatively, the member can do this while you set up your equipment and iPad. We also recommend setting a time frame at the start of the visit, informing them that there will be time for questions at the end. This will help you to move through the HRE efficiently and keep the member on task.
Have you had another in-home visit with a nurse practitioner or a physician from Signify Health in a previous year?
Yes, last year.
Okay, great. So just as a reminder, the reason that your insurance company's doing the visits is they're going more towards preventative health, good health promotion, and illness prevention. So we have about 45 minutes.
Okay.
This is mostly just asking you health questions, and at the end we'll have plenty of time for any additional questions that you might have over everything we covered.
Okay.
And it's I'm going to do a physical assessment at the end,
Okay.
and then also get some labs if you're okay with it, that the insurance company is requesting.
I am. I'm fine with that.
Okay. Can you tell me your name and date of birth, please?
Serena Robbins, and my date of birth is 4/6/1960.
Okay. And your marital status, please?
I am single.
And are you retired or still employed?
I'm retired.
Okay. And do you have a primary care provider?
I do. His name is Dr. Rowe.
Oh, Stephen Rowe.
Yes, Stephen Rowe.
On North Roosevelt Boulevard in Key West?
Yes,
Is that right? Okay.
that is correct.
And then still seeing Dr. Cindy Jones, the
I am,
orthopedic specialist?
yes.
Okay. Any other specialists that you've seen in the last year?
No.
Okay. And so let's go ahead and look over your prescriptions here.
Okay.
If you would.
Here we go. There's one.
And you're taking metformin 500 milligrams?
Yes, I am.
How many times a day?
Just once a day.
And why do you take that?
I take that for my type 2 diabetes.
Great. And do you take any insulin or any other medicines that would be refrigerated or in the bathroom or anywhere else in the home?
No, I do not. And let's see here.
And the amlodipine you're just taking for high blood pressure?
Yes.
Okay.
Well, no, I take another one too.
But no, haven't had any stents in the heart or
No,
congestive
it's
heart
just
failure?
for my high blood pressure.
Okay.
This one is the other
Okay.
blood pressure medicine.
Okay, losartan. Some of these medicines are used for multiple different reasons, so I just want to make sure that I've got the right diagnosis down for you.
Here's the Eliquis.
Okay, and then why did your doctor start you on the Eliquis?
I had a DVT.
Oh, about how long ago was that?
It was probably, I think it was about 3-4 weeks ago.
Okay, and have you had an ultrasound or anything to show if it's resolved?
Yes, I had an ultrasound, I think it was like 2 weeks ago.
Okay, and is it gone now? Is it resolved?
Yes, it's gone.
Okay, great. And so while you're taking the Eliquis, it's important that you not take any ibuprofen, Advil, Aleve, or aspirin products.
Okay.
If you ever need anything for pain over the counter, you want to stick with Tylenol.
Right, okay, that's what they told me.
And then has your doctor ever recommended taking a vitamin D supplement, or do you know if he's tested your vitamin D levels?
Not that I recall.
Okay, so that might be something to ask him about. A lot of people are deficient in vitamin D, and the older we get, especially, that's very important for not only for bone density, but for heart health and good immune function too. So you might ask him about either a vitamin D supplement or to see if you've had your vitamin D levels checked in the last year or so.
I will do that.
Okay. And then how about your over-the-counter
and this
supplements?
is my Tylenol also. So I have a vitamin.
Okay, multivitamin?
Yeah.
Okay.
And then this is my Tylenol.
Is that extra strength Tylenol?
It's an arthritis. 1 minute. Yeah. So.
Okay. And what kind of pain do you take that for?
I take that for my my knee pain and
some arthritis in your knees. Okay.
yes.
And then how about the cream? Do you use a over-the-counter cream as well?
I do.
Okay.
I use this cream.
Okay.
And then I also have some of this here, Voltaren.
The Voltaren gel.
Sure.
Okay. And was that prescription or was that over the counter that you got that
This was prescription.
one? Okay. Do you have any allergies to medicine that you know of?
No.
And then as far as family history, did either of your parents or any siblings or children have alcoholism?
No.
Breast cancer?
No cancers.
No cancers, okay. COPD or emphysema?
None.
Anyone diabetic in the immediate family?
Yes, I am and my sisters.
Okay. High blood pressure?
High blood pressure also.
Okay. Any heart disease, stents in the heart, bypass surgery, heart attacks?
No, nothing like that.
Any psychiatric disorders like anxiety, depression, bipolar disorder?
No.
Anyone have a stroke in the family?
No strokes.
Any other pertinent family history with anyone in just the immediate family?
No, not that I recall.
Aside from the DVT, have you been hospitalized or gone to the ER in the last 6 months?
No.
And you were just in the ER, not admitted with that with the blood clot, right?
Right.
Okay.
That was the only time.
Okay, and then compared to other people your age, would you say in general your health is excellent, very good, good, fair, or poor?
I'm going to say very good.
Okay, and then compared to a year ago, is your physical health in general better, about the same, or worse than a year ago?
It's pretty much about the same.
Okay, and then emotional health like anxiety, depression, that type of thing, is that better, about the same, or worse than a year ago?
It's about the same.
In the last month, have you had too little energy to do the things you want to do?
No, I do what I want to do.
Okay. In the last month, how many days did poor physical or mental health keep you from doing your
None.
normal day-to-day activities?
There's no depression or anything.
Okay. And do you live alone or with anybody else?
I stay alone.
Are you a caregiver for a young child, an elderly parent, or anyone else?
No.
Do you need help getting out of the house?
No, I don't.
Because of financial concerns, do you have to choose between paying for food, medicine, and other necessities?
No, I don't have those.
Any special needs, difficulty seeing, reading, or hearing?
No.
How about home safety? Do you have any grab bars in your bathroom for shower?
No, but I've been thinking about getting a grab bar.
So that's a good idea I think for everyone to have them just for safety getting out of the shower. I would recommend doing the ones that drill into the shower as opposed to the ones that just stick on.
Oh, okay.
And then also things like throw rugs. I recommend getting rid of all rugs or most rugs if possible, but especially throw rugs, and just make sure if you do have any rugs down that they're anti-slip on the bottom. And then also it's a good idea to make sure that both your front and back door have good lighting. The lights work.
Right. Okay.
Do you feel unsafe in your home?
No, I feel real safe.
And do you regularly use a cane or a walker or anything to help you get around?
No.
Do you regularly use a seatbelt in the car?
Always.
Any difficulty with cooking, cleaning, bathing, dressing, running errands, that type of stuff?
No.
Is independent with that?
I'm pretty independent.
Do you
yes.
normally get a flu shot in the fall?
I do. Every year.
And I would recommend the flu shot should be out anytime within the next several weeks or so. I would recommend getting one, ideally around October or so is a good time.
Okay.
How about a pneumonia vaccine? Have you had one of those?
I had one 2 years ago.
Okay, great. And then shingles, have you had shingles or had a shingles vaccine?
I have not.
Did you have chickenpox when you were a kid?
I did.
So 1 in 3 people that had chickenpox eventually gets the shingles. It lays dormant in the body, and it can come out later in life in the form of a rash that, if you know anyone who's had it, can be quite painful. There is a vaccine you can get to help you keep you from getting that. It's 2 shots in a 6-month time, and then you're good for life. It is over 90% effective, so it's a real effective shot. You can always ask your doctor about that. If they don't have it at their office, they'll usually have you go to any pharmacy. Most pharmacies are going to have that, shot there for you.
That's good to know.
Have you had a pap smear or pelvic exam?
No.
In the last
I haven't.
No.
It's been a while.
You haven't had a hysterectomy or anything?
No, I have not.
So those are recommended to have done at least every 3 years up until at least age 65. And obviously the pap smear is important just to assess for cervical cancer, but then in addition to that, they also feel around to make sure there's nothing abnormal going on with the ovaries. So I would definitely recommend scheduling one of those.
Okay.
Have you had a colonoscopy before?
Yes, I did. It was this year, probably about 3-4 months ago.
Okay.
They just told me not to come back for 10 years.
Okay, good. Must have been good then.
Yes.
Do you get mammograms?
I did. I just had one like a month and a half ago.
Okay.
And for my mammograms, they didn't have to do a diagnostic mammogram.
Okay.
But I was cleared.
Great. Okay. And I see you have your glucometer. Are you okay if I look at
Yes.
your results?
Yes.
Okay. Do you use your glucometer every day?
Yes. And there's a book inside there. Keep my readings.
Great. Okay. Do you happen to have any recent lab results from your doctor's office?
I couldn't find it.
Okay, no
I'm
problem.
Sorry.
No problem. And it looks like some of your morning blood sugars have been a little elevated. Do you have a snack before you go to bed?
I do.
What do you normally have?
And I normally have like a bowl of cereal, which I know I probably shouldn't, but it's really good.
Okay. Yeah, so a cereal's pretty high in carbohydrates and
Yes.
sugar. So I would recommend doing something a little bit lower in sugar with some more protein.
Okay.
Some celery with a tablespoon of peanut butter, some raw vegetables,
Okay.
Maybe a handful of almonds or some sort of nuts.
Right.
That's good. Some whole wheat crackers with peanut
Okay.
butter would be okay.
Okay.
That way you'll probably have less, you should have less high, lower
Yeah.
blood sugars in the morning then.
I'd just be afraid of it being too low,
Since you're not on insulin, it's usually not a problem, but it's a good idea to have that. But also you want to have some protein in order to sustain you through the night.
Okay.
So in addition to sweets and sodas, you really want to eat in moderation the breads, pastas, rice, and potatoes. Ideally, wheat or whole grain is going to be better than the white stuff.
Right,
Fish and
right.
chicken are good. Vegetables are good. Even fruit we have to be careful with. Although it's healthy sugar, it's still sugar. It'll still raise the blood sugar.
Okay.
Grapes, bananas, and pineapple tend to be among the highest. So it's usually recommended for diabetics to do no more than about a half a banana a day
Okay.
and no more than about 10 or 12 grapes a day. So really moderate with that.
Yeah.
Berries and oranges are going to be lower in sugar
Okay.
than the others.
I didn't know that about the banana. I usually eat a whole one.
Yeah, so I would say
Okay, that's
maybe
good to know.
try and stick with a half, and then something maybe like an egg or something with some protein to offset
Okay.
that. And then your health plan has requested that we do check your A1C and a urine microalbumin today.
Okay, we can do
Those
that.
indicate how well controlled your diabetes are.
Okay.
The A1C just requires that I stick your finger and we mail in the results. Your doctor will get the results, your health plan will get the results, and then you'll be able to access them as well.
Oh, good.
And then the urine microalbumin, I just need a small urine sample, and I can go over those results with you here today.
Okay.
Do you feel like you'd be able to give a urine sample now?
Not right now. I can drink some of this water.
Okay, sure. Yeah,
but,
if you can work on your water, and then maybe you'll be able
Okay,
to
yeah.
give a sample. I won't need very much.
Okay.
Are you okay if we check your A1C now?
Yes. Yes. I think we can use
Have you
this.
ever participated in a diabetic management program?
No, I have not.
So you might talk with your doctor about that. Diabetes can be really overwhelming, and sometimes people benefit by doing a diabetes management program.
Okay.
Like I said, your doctor will receive results, and your health plan does as well.
Okay.
And then your results will actually be mailed to you at this address here.
Okay. Do you know how long it takes?
I don't. I would guess within a week or two, but I'm not
Okay.
100% sure on that.
My hands are kind of cold, but I'm warming them up.
Great. Yeah, this one does require more blood than your standard glucometer would.
Okay. And you'll mail that off?
I will. I'll mail it, yes.
Oh, okay.
And which finger would you like me to use? Middle?
I think this one's probably, yes, this middle one. That is a lot of blood.
It sure is. Hold that. Thank you.
You get enough?
Yep.
And that's going to check my A1C.
Your A1C gives the shows how well controlled your diabetes has been over the last 3 months.
Okay.
Yes.
I think the last time it may have got last year, I believe it was 5.6.
Oh, that's very good. Okay, great.
I think I can go to the restroom now.
Okay, perfect. If you want to go ahead and get a small urine sample,
Okay.
and go. Like I said, I don't need very much, and then we'll test for that when you get back.
Okay. Okay, here you
Great.
go.
Thank you.
You're welcome.
So this test checks for microalbumin in the urine, which indicates that the diabetes can be affecting the kidneys.
Okay.
And your urine does show microalbumin. Has your doctor ever mentioned that to you, microalbuminuria?
I don't recall.
Okay, so the first indicator, like I said, that the diabetes is affecting the kidneys. Since you have a positive test, it's important that your doctor repeats that and with another lab result,
Okay.
another lab test in the next 3 to 6 months. Do you have another appointment scheduled with
I
them?
do. I have one scheduled. I think it's in three months.
Okay, great. So that's important. And then in addition to keeping your diabetes and your high blood pressure control, which is really important for your kidneys, another thing is you really want to avoid salt and then watch your high sodium food. So things that are prepackaged, especially in a can, tend to be high in sodium. So fresh food is going to be lower than frozen, and frozen's lower than canned as far as sodium. And so really good to watch the sodium content, since that can affect the kidneys as well. Also, make sure you're drinking a lot of water. Dehydration can definitely affect the kidneys as well.
Okay. So, and my doctor will get that result?
He will, yeah. He'll get results of all this and the entire assessment as well.
Okay. Okay, that's good to know.
Cancel. Okay, so I'm just going to scan this here. This just registers the A1C that I drew on you.
Okay.
And have you ever had an organ or a tissue transplant?
No, never.
In the last 12 months, has a doctor or other healthcare provider talked to you about your level of exercise or physical activity?
No.
Okay. In the last 12 months, has a doctor or other healthcare provider advised you to start, increase, or maintain your level of exercise?
No.
Okay. So the recommendation for all of us, just for heart health, keep blood pressure, cholesterol down, of course your blood sugar controlled as well, is 30 minutes a day, 5 days a week of moderate intensity exercise. So things like walking, swimming, riding a stationary bicycle is great.
Okay.
Any chronic or ongoing pain issues, any pain that you deal with most days? You mentioned having some arthritis in your knee?
Yeah, my knees, numbness and tingling.
Okay.
My feet.
And how often do you take the Tylenol in the creams?
I usually do this daily.
Okay. On a bad day, how many Tylenol total would you take?
2.
Okay. In the last month, how much has your pain interfered with your normal day-to-day activities?
Not much, I think, because I've had it so long.
Okay, just a little bit, you're used to it?
Yeah.
Okay. And then if you had to rate your pain on a scale of 0 to 10, 10 being the worst pain you could imagine, what is it in general, would you say?
In general, it's probably about a 4.
Okay. All the time, or does it come and go?
Just depend on what I've done, but for the most part, 4 all the time. When I take the Tylenol, it probably brings it down to about a 2.
And about how long's that been going on? More than 6 months or less?
Oh yeah, more than 6 months.
Okay.
Yeah.
And then how about the neuropathy in your feet? Is that painful or is that just annoying?
It's more painful.
Painful?
Yeah.
Does the gabapentin kind of help take the edge off?
It does.
And the neuropathy is just in the feet, not in the lower legs,
It's
correct?
just in my feet.
Have you been to an eye doctor in the last year?
1 year ago. I need to go again.
Okay.
Yes.
So it's really important to go to get your eyes checked at least once a year, especially because you're diabetic, because the diabetes can affect the eyes.
Yeah.
And especially important that you make sure you let your doctor know the eye doctor know if you have any changes in vision.
Yeah. I think he said I had a cataract. He said it was very small though.
Okay. And those can take years before they get to the point where they are large enough to be removed. How's your vision?
I am nearsighted.
Okay. You see okay with Do you just
Yeah.
read with
No,
those
these
glasses,
are,
or-
I need to wear these to see far away.
Okay.
I don't wear reading glasses though.
Okay. And any problems with your mouth or teeth?
No,
No sleep apnea, don't have a CPAP or BiPAP machine?
no, I do not.
Hearing loss or wear hearing aids
No,
or anything?
I hear just fine.
Any problem with wheezing, shortness of breath, or coughing often?
No,
Are you exposed secondhand smoke often?
no,
Do you remember having a spirometry test done to check your lung function?
I don't know if I know what that is, so maybe not.
Normally have you breathe into a tube to check your breathing, but you've not been diagnosed with asthma or anything?
No.
Okay. And are you a smoker?
No, I'm not.
Were you a smoker in the past?
No,
Do you get short of breath when you lay down?
no,
Ever had a heart attack, a stent in the heart, or in the legs?
no, I have not.
When you walk, do you get pain in the back of the calf or the back of the thigh muscle that gets better when you sit down?
No,
And no pacemaker or defibrillator?
no,
Any problem recently with chest pain, pressure, or heart palpitations? Excessive bloating after you eat?
no,
Ever been told you have chronic hepatitis?
no,
Frequent upper abdominal pain?
none,
Acid reflux or heartburn often?
no,
Chronic constipation?
no,
In the last month, have you had difficulty holding in your urine?
no, I have not.
Frequent urinary tract infections?
Nothing like that.
You can educate the members on pain management immediately after the pain assessment for efficiency purposes. Combining sections like this is a good way to reduce the time the assessment takes. Other areas that you might combine include the musculoskeletal review of systems when discussing a member's joint pain, or malnutrition and osteoporosis questions while conducting height and weight measurements.
And does your arthritis in your knees, is it worse when you first get up and then it gets a little bit better once you get up and move
Yeah,
around?
once I start moving around.
Okay. Do you have stiffness in your joints in the morning that lasts at least an hour?
Yeah, I can say, yeah, that's pretty true.
And a lot of times when people have arthritis, they want to stop moving, and that's the worst thing you can do. Otherwise, that pain and stiffness are going to get worse. So another good reason to make sure you're continuing to stay active. Do you exercise at all?
No, I don't.
Okay. So again, I would just encourage you to kind of try and increase
Yeah.
that as much as you can. Even if you don't do 30 minutes a day, 5 days a week, that's a good goal to, so it's kind of start
Yeah.
slow and then work something to work up
And I've
to.
been wanting to go up to the school track, so I probably need to go up
Great,
there
and
in the evening.
you'll find the more active you are, probably the arthritis in your knees is going to be better controlled as well.
Okay.
Do you get dizzy when you stand up?
No, I do not.
And no recent episodes of fainting,
No.
loss of consciousness? Have you ever had a stroke or a mini stroke?
No, I have not.
In the last year, have you fallen more than twice or had issues with your balance?
I wouldn't say I had issues with the balance. I think I just tripped on the curb.
Okay. Did you fall down more than twice, or was that just a
It was
fluke
just the
thing?
one
Okay.
time.
Ever have polio as a child?
No, I did not.
Are your feet numb, or do they just tingle and burn?
They tingle and numbness.
So numb too.
Yeah.
Okay. How about weakness in your legs?
No,
Do you regularly experience stress, loneliness, or anxiety to the point where they interfere with your daily activities?
no, I do not.
Have you ever drank alcohol?
Oh, yes.
Okay, I'm going to ask you a few questions about alcohol use.
Okay.
Have you ever thought you needed to cut down on your drinking?
No, I have not.
Have people annoyed you by criticizing your drinking?
No, they have not.
Have you ever felt bad or guilty about your drinking?
No, I have not.
Have you ever needed an eye opener or a drink in the morning to steady your nerves?
No,
And then you don't have any sleep, you don't use anything for sleep or have any old prescriptions for sleep or for pain that would be potentially addictive?
Every now and then I may have some peppermint tea just
okay.
to get some sleep.
Sure.
But no.
Have you been on treatment for more than a year for a mood disorder like anxiety or depression?
No.
Have you been bothered by feeling down, depressed, or hopeless for many years?
No.
Or been bothered by having no interest or pleasure in doing things for many years?
No.
And then just how about the last 2 weeks? Have you often been bothered by feeling depressed or hopeless?
No.
And then often been bothered by no interest or pleasure in doing things just over the last 2 weeks?
No.
Great.
You do not need to repeat questions if the information has already been obtained during your conversation with a member. In this example, the type 2 diabetes diagnosis and management were previously discussed. Thus, the endocrine section is able to be completed without repeating any questions. The recommendations you select will automatically transfer to the Leave Behind section of the HRE. Fill out the Leave Behind form. also called the Personal Health Care Assessment, and include the education points throughout the evaluation so that you can quickly review with a member prior to leaving their home.
And then also, has your doctor ever talked to you about going on a statin? Have you ever taken a statin or any medicine for your cholesterol?
I recall taking that one time, and it seemed like it made me dizzy or something.
Okay, and then your doctor took you off of it?
Yeah,
and he
took
didn't
me, yeah.
press
I've
anything
never
else?
taken
Okay,
it since.
so I would definitely recommend talking to your doctor about possibly trying another one. A lot of times people can't tolerate one statin or one medicine for cholesterol, but they can another one. And so just because it caused dizziness with one doesn't necessarily mean it'll be the entire class of medicines.
Okay.
And research has shown that being on a statin or cholesterol lowering medicine when you're diabetic does help to decrease the risk of cardiovascular incidences like heart attacks and strokes.
Okay.
Have you ever had a hip replacement?
No, I have not.
Do you know if you're more than 2 inches shorter than you were when you were 20 years old?
I'm 1 inch short.
Okay.
Shorter.
I imagine you've not had a bone density test done yet.
No, I have not.
Okay. Normally they'll start that when you're 65.
Okay.
And have you ever been diagnosed with any cancer, including skin cancer?
No.
In the last 6 months, have you lost weight without trying?
No, I have not.
Any concerns over inability to obtain food? Are you able to get sufficient amount of food?
Yes,
Okay.
I can get food.
Do you eat at least 2 meals a day?
I usually eat about 3 or 4 small meals a day.
Okay. And then in general, would you say you have 2 or more servings of fruits or vegetables in a day?
Yes, I do.
And then next thing we have to do is 2 short tests. The first one is going to be what we call a get up and go test. It checks for, assesses for any mobility problems, loss of balance, that type of thing. And so I'm going to have you stand up, and then I'll have you walk about 10 feet and turn around and then come sit back down. And just do it as briskly and as safely as possible. You don't have to run or anything, just a normal good pace.
Oh, okay. Okay, yeah, we can go right over here.
Okay, and I'll have you go ahead and have a seat if you would.
Okay.
So next thing we're going to do is called a get up and go test.
Okay.
When I say go, I'll have you stand up and walk about 10 feet and then turn around, come back, and then sit down.
Okay.
Just kind of swiftly but safely.
Okay.
And go ahead and go. Great. Okay, so that's 8 seconds. Anything less than 10 seconds shows no increased risk of falls.
Good.
Okay. And then I'll need to go ahead and get your height and weight if you don't mind.
Okay.
And there's that. Okay. And then I'll have you just stand against the wall if you would to get your height. Okay, great, thank you.
Okay.
And this shows you right at 5'7".
5'7".
Great.
Thank you. Okay.
So the next test we're going to do is called a cognitive impairment screen. It just checks for any memory loss, cognitive impairment, that type of thing. I'm going to say 3 words and ask you to remember them for just a minute.
Okay.
And then try to remember them because I'll ask you to repeat them back to me, okay? It's banana, sunrise, and chair.
Okay.
So can you repeat those back? I just want to make sure you heard me right.
Sunrise, and chair.
You got it. So just remember that for just a minute.
Okay.
The second part of that is if you can draw the face of a clock. I'll have you put at least the 4 big numbers in there, if not all of them.
Okay.
And then I'll have you put the hands at 10 minutes past 11 o'clock.
Let me go ahead and do it now.
Mm-hmm.
Okay. "10 minutes past 11.
Right.
Okay.
And then do you remember any of those 3 words I asked you to remember?
Banana sunrise chair.
Yep, you got it. And would you say that you experience memory loss that significantly interferes with your daily activities? Is that a problem?
No. No, that's not been a problem.
Great. And then last thing I need to do is just a quick physical assessment.
Okay.
You okay if we do that?
Yeah.
I'm gonna check your eyes. I'm gonna shine a light in them. Just look straight at me.
Okay.
Take a look in your mouth.
Uh,
Clench your teeth, do it. And tell me if you hear anything in this ear.
I do.
How about this one?
I do.
So we check a blood pressure both sitting and standing. I'll have you do it sitting first.
Okay.
And then I'll have you stand up and we'll recheck it.
Okay.
And the reason we do 2 is to check for any significant drop in blood pressure when you stand up.
Okay.
It's the pulse oximeter. Just gonna monitor your oxygen saturation. I'll just have you slide that. I'll just have you slide that in one of these fingers if you would. Do you check your blood pressure at home at all?
I do. I have a electronic one I put on my wrist.
Okay. It's good to keep an eye on it at home as well as at the doctor's office, of course. Got 124 over 66. Great.
It's pretty good.
I'm gonna have you stand up and we'll recheck it.
Okay.
One 130 over 72. Great. And you can just keep on standing. I'm gonna take a listen to your heart and lungs here. I'll have you take some deep breaths in and out if you would, please. I'm gonna take a listen to your carotid arteries in your neck and you can just breathe normally.
Okay.
Take a listen to your heart.
Okay.
Take a listen a little further down in your heart, underneath your breast. Would you be okay if you just lift it up a little bit? Okay. Thank you. Great, thank you. I'm just going to listen to your abdomen, and then I'm going to kind of feel around and just have you let me know if there's any areas of sensitivity.
Okay. That's fine.
Okay. I'm going to have you hold your arms out in front of you like this. Check the strength in your arms.
Okay.
I'm going to have you push against my hands.
All right.
And then bring your arms down against my hands as well. Great.
Right.
I'll have you do this. Okay. And then push against my hands again.
Okay.
And then bring your arms back towards you to push against my hands. Great. I'll have you grab on my fingers and give a good squeeze. Just check in your grip. Okay. I'm just going to have you let your arms kind of go limp.
Okay.
Great. Then I'm going to check the strength in your legs. I'm going to push here. I'll have you push against my hand. Bring your leg up.
Okay.
Great. And then this one. And I'm going to check your reflexes in your knees. I'll have you scoot back to make sure your legs are just kind of free hanging, if you would, please.
Wow.
That's a good one. And then I'll have you push against my hands again. And then bring your legs back towards you to push against my hands. And I'll have you do the same thing with your feet, like you're pushing down on a pedal.
Okay.
Great. And then push up against my hands. And then check your reflexes in your ankle as well. Just kind of let your foot go limp.
Okay.
And then I'm going to check sensation on your feet. This is a little bendy straw, kind of like a toothbrush bristle almost. Just going to feel real light like this on your foot. I'll have you close your eyes when I do this and tell me when you feel it.
Okay. I feel that. I feel that. Yes. 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 I feel that. I feel that. Yes. I feel that. I feel that. Yes.
Great. You're going to feel on your pulses on the top of your feet.
Okay.
Okay, good pulses. And then I'll have you keep your eyes closed. And tell me if I'm pushing your big toe down to the ground or bringing it up towards you.
You're taking it down to the ground. And this one's up towards me.
Okay, great. So you do have one area on both feet that you do have a loss of sensation on there, and that's important for you to know.
Okay. What does that mean?
So the diabetes, the neuropathy that you have, the numbness and tingling,
Yeah.
is due to elevated blood sugars. And
Oh,
sometimes
okay.
that can affect the nerve so much that you lose sensation in your feet. And so not only do you have the numbness and tingling, but some of those nerves have been affected enough
Oh,
to make
okay.
you lose that. So that's why it's really important. It can put you at increased risk of falls. So
Okay.
it's just good for you to be cognizant of the risk of falls, and also of if you happen to step on something, you might not necessarily feel it. So
Okay.
you want to keep an eye on your feet. Good feet inspections regularly, and then also I would definitely recommend asking your doctor to refer you to a podiatrist for regular foot checks. A lot of
Okay.
times they'll trim your nails every few months and just keep an eye, and then be able to identify if there's any areas of skin breakdown before it gets to be too severe.
Okay, well that's good to know.
So I wrote out a list of recommendations for you. You can take this with you to your doctor's office the next time you have an appointment.
Okay.
This is everything we talked about today. Annually, it's a good idea to go over your vaccination plan with your doctor. Based on what you told me today, looks like you're up to date on all the preventative health screenings and vaccinations, other than a shingles shot.
Right.
Again, that's 2 shots in a 6-month time, and you're good for life.
Okay.
And I would recommend getting a flu vaccine somewhere around October or so.
Okay.
We talked about that living will. Definitely recommend
Right.
working on that. And then as far as the diabetes, you want to continue being tested for the A1C, cholesterol, and kidney function.
Okay.
And then, like we talked about, definitely discuss with your doctor on maybe starting a statin or another medicine to lower your cholesterol. Just being diabetic puts you at higher risk of heart attacks, strokes,
Okay.
those type of cardiovascular events. And then because you did have a couple areas on your feet that had decreased sensation, I would definitely recommend talking to your doctor about getting a nerve screening annually.
Okay.
And then also you might want to discuss with him a diabetes self-management program, which can be beneficial for diabetics.
Okay.
And then safety safety risk, again, handrails in your bathroom, and then
the grab bar.
grab bars, yep. And
Okay.
then non-skid material underneath rugs or just take up throw rugs.
Okay.
And then again, pap smear pelvic exams recommended every 3 years up until at least 65. So I definitely would recommend getting one of those scheduled. And then, like we talked about, avoid salt and high sodium food. And then also the ibuprofen, Advils, Aleve, and aspirin products you want to avoid, and just stick with the Tylenol like you've been doing.
Okay.
Now on the back side, I've got your blood pressure, pulse today, and then your creatinine microalbumin that we checked with your urine sample.
Okay.
And again, your doctor will want to repeat that within 3 to 6 months. And then at the bottom here, I circled, there is a website, the signifyhealth.com website, where you can get your a copy of this, as well as your lab results of the labs that we took today in a few days.
Oh, okay.
And then I would keep this with you here. This is just a copy for you.
Okay.
And then they will also mail you to your home the lab results as well.
Okay.
Did you have any other questions on anything that we talked about today?
No, I think I'll go to this website, signifyhealth.com. And it says here in a few days I can get these test results.
Great, yes.
Okay.
Yep.
All right. And this here?
And then they will give that to your physician as well.
Okay. Okay, I will do that.
The signature of the member is a required part of the HRE. If unable to obtain a signature, a note should be made as to why the member is unable to sign. And face-to-face time needs to be selected after the member signature and the assessment has ended. However, the assessment does not need to be finalized while at the member's home.
And then the last thing I need for you to do is read over this paragraph here and then sign. And this says, I performed a health assessment on you. And again, your PCP and your health plan will receive a copy of all of this.
Okay.
And then additionally, since I'm not your primary care provider, if you have any concerns regarding your health, you want to take that up with your primary care doctor.
All right. There.
Okay. Thank you.
So I'll do another one of these next year.
Yeah, they'll call you sometime next year to see if a nurse practitioner or a physician from Signify can come out to see you.
Okay. Sounds good.
Great, and thank you so much for your time.
All right, well, thank you. Thank you for coming.
My pleasure.
And the creatinine?
Creatinine?
Creatinine. And the microalbumin, that was from the urine.
That's right.
When you put that stick in there.
That's right, yeah.
Okay.
That was elevated. That shows that your kidneys are starting to be affected by the diabetes. So it's important that your doctor knows about that.
Okay.
And in screens for that within the next 3 to 6 months.
Okay. All right. I have that appointment in 3 months, so I can just take this
Yes.
to the
That'll be great.
office with me.
And again, he will receive a copy of your labs as well as the assessment that we did here today.
Okay. All right, well, I'll just, and you're finished looking, I can get all of my
I'm all
meds
done with
and
those.
put-
Thank you very much.
Okay. All right, well, thank you for coming.
My pleasure.
And you can just, I'll get the trash.
Thank you. And then this is your A1C that I'm going to mail out, and I'll get those results I'm online there in a few days.
Okay, good. That's good to know.
Thank you again for your time.
All right, you're welcome.
Here we see the clinician reviewing her evaluation and making minor corrections to her documentation. If there had been any case management referrals, she would be taking those steps at this time, as long as the member had agreed to receiving a phone call from case management. In this instance, she is reviewing her documentation in her car immediately following the visit. However, it can be done at any time prior to finalization. Some providers do this at the end of the day. The only restriction is that all assessments have to be finalized and/or appropriately statused before you can view your next day's work.